All right. Hello, everyone. My name is Cassandra Trimnell. I am Executive Director at Sickle Cell 101 and fellow Sickle Cell Warrior. I'm so happy to host this panel today. The theme of this panel is answering the tough questions related to sickle cell disease. These are topics that don't really get discussed and could even be controversial. I don't know. I guess we'll have to ask the panelists what they think. So I'm looking forward to today's discussion. So I have here with me Tahirah Austin, Terry Jackson, Phillip Okwo, and Rae Blaylark. So welcome. I guess let's start off with having each of you introduce yourselves.
So again, my name is Tahirah Austin-Muhammad. I am the Chief Operations Officer at Crescent Foundation. We're here in Philadelphia. We serve adults living with sickle cell disease in Philadelphia and the Delaware Valley. We have partnerships with our local adult hospitals and support from our local pediatric hospitals. I'm also an adult living with sickle cell disease. I live with genotype SS. And I'm a wife, I'm a mother. My daughter has trait. I knew my husband did not have, he wasn't a carrier of sickle cell disease during my courtship. And that's another discussion, but I had a Islamic courtship before I was absolutely married. And that's a part of the courtship process of just finding out everything that each one of us carry genetically in terms of family planning.
Hello, everyone. My name is Phillip Okwo. I am a sickle cell warrior, S-beta-0 thalassemia. I am, again, LA raised, but now reside in Atlanta by way of Houston, Texas. So hopscotching across the country. I am a father of two. A 5-year-old son and a 2-year-old daughter who both have the trait, and similarly had that whole genotype discussion, with their mom. And I'm a board member of Sickle Cell Association of Houston, and I guess co-collaborator of the Blood Brothers podcast. I don't know if I mentioned that one before. And looking forward to the discussion.
Okay, hello, my name is Terry Jackson. I have SS as my genotype. I was the first poster child for the state of Virginia for sickle cell disease, and that really influenced my life heavily. And so I went to school, and now I have a PhD in genetics and genomics from Duke University. And as I said, that was what got me so interested in science, was actually having this illness. Something interesting about me, well, I was actually working at Stanford in California. This is where I met Cassandra. And I dropped everything and came home to help take care of my stepfather who has Parkinson's disease, and my mother, to help her take care of him, because I was aware of how difficult it is being a caregiver. And I didn't want caregiver burnout to happen. Even if you love somebody a trillion, it can still happen. And I didn't believe that he deserved that. So I dropped everything and came home. And so right now, I just work at a garden center. And I love it. I actually love it. So part-time, it's fun.
I am Rae Blaylark. I am the mother of a 24-year-old male warrior with SS. I carry the trait. I am also the founder and executive director at Sickle Cell Foundation of Minnesota. And the third side of my hat is I am the sickle cell patient family care coordinator and patient advocate at our local children's hospital here in Minneapolis.
She does it all.
Oh, something fun about me. My husband is a motorcycle lover, so he likes to get me on the back of that and traipse across the cities and across borders, and I refuse to buy one of my own, and he's trying to make me.
For sure. Thank you so very much. All right, so we'll just go ahead and get into the first question I have for you all. So this question may sound obvious or may seem obvious, but I guess at this point of your life, just taking all factors and everything that we have today into account, what's more appealing to you? And would this be a cure, I guess, and this would be by way of bone marrow transplant or gene therapy, or would this be treatments to help manage sickle cell disease? So what, I guess, is more appealing to you?
On a personal level, as an individual, I would think treatments. And I say that because there's so many of us as adults who have been through the wire with sickle cell disease, even with just organ damage. And right now, we may be thriving, but the damage that has been done is irreversible. And so I think going into these curative therapies, it's a huge, heavy risk, that it may do more damage because of so much that we've endured over the years. I think curative therapy, when I look at it, is for, those who can withstand it health-wise, but also those children who they get a chance now to not endure all of the years of pain and sickness and organ damage that we've gone through as adults. So you kind of get to stop it or get ahead of it before they get older. That's how I think of curative therapy. If not for me, then for the future. But as far as treatments, I would love for us to have treatments that are universal and that everyone is able to access, and when it's not according to the type of insurance that they have, where they're located, whether they're in the city or in a rural area, and a treatment that it doesn't matter what genotype you have, because you're under the umbrella of sickle cell disease, this treatment will work for you. This treatment will give you a better quality of life. And that's what when it comes to adults with sickle cell disease, what I like to, advocate for is a better quality of life that they're having now, because then that way you have something to live for or look towards, as someone who wants to be independent or live an independent lifestyle. And so definitely better treatments. It's not that I'm opposed to curative therapy, but I'm for a better quality of life with a universal treatment than a cure. I don't know what's going on.
A perfect word, which is, she used the word curative, which I just learned recently as a distinction between a cure, as in, I'm guessing, a universal cure versus something that can help, but is not necessarily guaranteed. And I don't, my overall philosophical view on sickle cell in general is and the challenges we face in healthcare system here in the United States is a matter of treating our chronic illness proactively versus reactively. And I think the healthcare system is unfortunately primarily reactive. And so if I could add a third option to this choice, I think in addition to a cure versus a treatment, is I would love to see a much more seamless or cohesive recommendations on how we can better manage our sickle cell proactively, as in nutrition, yoga, whatever those things may be, to minimize the severity of it. And I think, unfortunately, those options in the traditional healthcare system that we encounter aren't very well developed. They don't seem as robust as maybe they could be, in my view. So cure, treatment, and or proactively, naturopathically preventing sickle cell, to me, might be an even better option. And I can go into why a little bit more further in the conversation.
All right. May I now? May I speak?
Yes.
Were you finished? I'm sorry.
I was. Thank you.
Okay. Fantastic. I believe that for myself personally, that I just would like to have a treatment where, I'm just fine. I don't have to deal with these crises anymore. I've lived a long life. I'm middle-aged, and I know that these procedures for cures are like they said, they're a bit risky, and your body needs to be a little bit more plastic to bounce back once you've had these types of these surgeries.
Mm-hmm.
Someone has also asked me before, and I had to think about this really hard. Did I not want to have an actual cure because sickle cell is part of my identity? And so, the honest answer was partially yes. It is part of my identity. If I didn't have sickle cell, who am I? It's kind of that type of a situation. But I think that's more 30%, and it's more 70% that, I just feel like I'm at a point where, although I have daily pain, I don't have as many hospitalizations as I used to have. And even so, I don't have as much organ damage as I think I actually should. I've had some terrible, terrible crises, multiple, but my organs have actually are in actually pretty good shape. So that's also part of the reason why I might feel like, okay, I think that I can have sickle cell and live to old age, is how I feel. So that's my answer right there.
So I'll give a little bit of a different perspective as a caregiver. I think that from a caregiver perspective, and I've kind of surveyed so many individuals and caregivers to see what they think as well. Because as a parent who watches your child in agony, who watches your child suffer, a parent is a fixer, and the inability to fix it, the inability to take it away, it makes you yearn. Not them, put it on me, right? And so that the heart for a cure is kind of where I live. But I also think, and thank you, Phil, for saying it, that some of those are tricky words, right? When we talk about curative options, cures, because we don't talk a lot about the fact that you still have trait. You can still pass the trait along. So how much of a cure is that if it is still in the genetic line? And so now when I've asked my son, and we have many discussions about this, and he's had opportunities to potentially dig a little bit deeper, and he reflects much of what you all have said. In some ways, it's all he knows. He is more comfortable with what he doesn't know, even in his discomfort, and what he does know, even in his discomfort, than he is in what he doesn't know and may not know about what's ahead in exploring or participating in those other curative therapies. And so, learning to honor and respect that as because he is an autonomous being, even though he's my child and I might try to make him, he just is not going to. But I also understand both sides of it from a caregiver perspective versus a warrior perspective.
May I say one more thing, and I think it fits into this actual question, and that is, as you were all referring to the curative versus the cure, and I guess also I am a stickler about that, because many of these therapies, they don't actually cure, they don't change the mutation. Okay, all they do is they give you some more fetal hemoglobin production or something like that. They don't actually change that actual mutation. And so when I heard, there are these cures, I'm like, oh, really? Oh, wow. And then I went and looked it up, and it's like, I was like, they don't even, it's not fixing the mutation? Like, well, okay, talk to me when they do that. Once the mutation is actually fixed, let's talk. And, then there's also a big difference between, and so therefore you can get cured, have this cure, but you're still passing on the sickle cell gene down the line.
Sorry, I didn't mean to step on you, but I think that's an important question, right? Because as Terry alluded to earlier, kind of risk reward, particularly for those of us who are older and have kids, right? That we, you know, it's like, you know, I'll be 40 next year, and so the question of something whereas I could go through this treatment and, you know, it might cause me to be unable to have children going forward. And even then, there's still no guarantee that that it is a cure, and that it will do what I needed to do, or even if it does succeed, that I will recover because of, you know, because I'm not as plastic as I might have been 20 years ago, right? And so that risk reward is something where, for me, at my stage, in my chapter with my sickle cell journey, I'm going to lean more towards the treatment, and hopefully a treatment, something that I can do to prevent myself having that organ damage that Tahirah mentioned, or to prevent myself from having the severity or requiring the hospitalizations to begin with. And another, a second reason for me that this is big is because I didn't do an interesting thing about me earlier. So here's one that and it factors into all of my advocacy and discussions on the subject, is that I'm, you know, lucky to be dealing with sickle cell here in the US, but I'm British by birth, I'm Nigerian by blood, and I'm American by naturalization. And so I have many cousins and loved ones who are in Nigeria, and I'm often thinking about them in terms of what are some of these options, and in a way that, I don't know if this is a survivor's guilt thing, but I do feel a certain kind of way about having treatment options available to me that aren't available to them. And as much as, particularly being from West Africa, I understand the impetus to want to leapfrog, right? The idea that, all right, well, you know, we didn't have extensive landline infrastructure in West Africa, but we're all on cell phones, and many people have 2, sometimes 3 cell phones in Nigeria. But the idea that sickle cell, having been around and known about for going on 120 years now, has really had no real treatment options, primarily hydroxyurea for much of the last 20 years. And then, you know, we're starting to see a lot of stuff in the pipeline, which is great, but sickle cell is too complex a condition. And yes, it is a single mutation, but the manifestations, I mean, I know of twins with sickle cell who their sickle cell does not manifest the same. And so we need to really do a lot to lay the groundwork, I think, in terms of treatment options before we look to leapfrog directly into a cure. Now, that's not to say that if, you know, for example, your son, Rae, you know, if he's young and plastic enough and maybe doesn't, you know, the risk reward comes out different for him, that he shouldn't pursue some of those curative options. But I think we definitely want to emphasize as many treatment options as we can, not just for, you know, because you don't want it to be a first world situation, right? Where those of us with sickle cell in the first world will benefit, and then the rest of the world just, you know, whenever they get whenever that becomes an option for them, you know, who knows how long that.
I mean, it's in Ghana, they're just now getting hydroxyurea access.
Exactly.
Right. And I know that because I lived there and I got sick there. And I was like, wait, I got to pay for my medicine inpatient.
Right.
This is how the system works here. It was mind blowing. So to know that when I come back to the States, the care that I complain about the most, right? When I'm my ED experiences, my inpatient experiences here in the US is top notch. In comparison to even in the Caribbean, where my family is from. I've been sick in Trinidad. I've been sick in Barbados. And it is mind-blowing that my family members are living over there like that, right? And when they get sick, this is what they experience.
Yeah, and I think the cure versus therapy option is, as you said, it's first about making it universally available and accessible. Just because it's available doesn't mean it's accessible.
Exactly.
But then it also depends. There are so many different phenotypes, and people have had so many different levels of experiences and levels of quality care at various times in their life, or lack thereof. That's really going to drive them in one direction over the other many times. And so being able to offer our community more than just, one therapy and more than just one curative option. We need a whole slew, a whole menu of options to choose from so that we can actually choose and make an informed decision about what is best for us in our situation and the journey that we've had with sickle cell individually.
Phil mentioned something that often comes up in Crescent about integrative health, so having yoga or access to yoga, having access to acupuncture, and all of these other things that are preventative options, right? Or preventative treatments to not only just help you cope, but help you just have a better quality of life when it comes to experiencing and living with chronic pain. And what I've noticed is within the hospital systems, they don't want that they don't want to take that on.
They'll do it in pediatrics, but not adults. They'll sing its praises.
They will build
in pediatrics.
entire integrative health centers in pediatrics. I literally participated in a yoga and acupuncture study in pediatrics, and then it just does not cross over. No. You're talking about in Philadelphia where CHOP and Penn or HUP are directly across the street from each other. And all of the pediatric doctors at CHOP are assistant professors at University of Penn. So it's crazy how it just does not translate at all. Right. And so, but I totally agree. And if I feel like for us in Philadelphia, for integrative health, that is something that it seems like Crescent is going to have to take up the helm to have our adults living with sickle cell disease be able to access those things.
And not just access them, but I'm looking forward to our community duplicating those things, right? To a great extent, we are depending on a system to create the things that we need to go the extra mile to create those things for ourselves, so that we have centers of care that are about integrative medicine, that are non-traditional approaches, that is for us, by us.
I just wanted to ask a follow-up question, because I noticed when we do ask that question within the community, curative versus treatment, I find a lot of people living with sickle cell disease saying treatment, and a lot of caregivers saying the opposite, cure. And I just don't know if that's something you can speak to a little bit more. I feel like my mom would say the same thing. You better go try and get the cure.
My dad too.
Wow.
Exactly. It really is about removing the suffering. And so, I would arguably say if that were delivered in a treatment and we didn't have some of the traumatic experiences as a parent of watching our children suffer, these are looking to us, screaming our names. I'm going to go out on a limb. I'm going to say when the George Floyd murder happened right here in our city. It was a block and a half from where I grew up. And so it hit me different, right? And at that point when he cried for his mama, I broke, and it took me weeks to put myself back together, because it triggered something that I didn't even know was in me in all the times that my son cried for mama, when he was in the hospital, when he was in pain, when they couldn't find a vein and they were sticking him for the 4th or 5th time at 2, 3, 4, 5 years old. Those are traumas that live on us as parents and caregivers. And so when you're watching someone else, someone you love, that could be your spouse, that could be, when you're watching someone and you are the person who they see as their protector in a sense, and you can't protect, you want that cure, and I'll walk you there. So let's go.
That's powerful. Yes, ma'am.
Yeah.
I think also, so here's an example kind of outside of the sickle cell space, just to give you context, right? And so I've worn glasses almost my whole life, right? Since I was 8 years old. And my joke is that I was reading straight out the womb, and that's why I needed glasses by age 8. It may have been some sickle cell related stuff, who knows? But when I, got married and was getting ready to have kids, I had gone to get this LASIK inquiry many times, right? And to see what was, is it worth it? Initially, it was too expensive. But after getting married, the price had come down quite a bit. It had been a few years, but they did an interesting thing where they sold my wife by showing her what my uncorrected vision looked like. They put the lenses so that she could see, and she just was like, no way, you're not going to be driving our kids with that kind of vision. Even though I had corrective lenses, even though I was wearing contact lenses, I have glasses, and I've always worn them. But for me, even though the price had come down for LASIK so much so, it still didn't seem like, I had frame of reference. I mean, I've basically learned to live my whole life since age 8 with this, deficient, deficient vision. And so to me, it didn't seem that even then, maybe the trade-off would have been more than I realized, because I had come to, it was a part of my identity, as Terry alluded to, in one sense. And I guess I had been so far removed from what uncorrected vision looked like that it just didn't seem like it was necessarily that high of a reward. And so that was an interesting thing. So she insisted. Obviously, she won out. I got LASIK. I now have 20/20 vision. Yay, hooray, right? But I don't know that. I think that's something I have to be mindful of too when I give that decision. And so if I step away from the emotionality of sickle cell and what it may mean for my mortality or whatever the case may be, like, that's an interesting bit of psychology for me. That I wasn't that pressed to get my eyes fixed, even though, in theory, there's much more upside than downside, right? When you make when you change the parallel over to the sickle cell question. So I guess more food for thought.
Yeah.
That's a really good analogy.
But what's also interesting, though, as a father now, is that, I understand what that struck in you. None of us wants to see our children in any kind of pain. But I also feel like the pain has been such an important part of my growth, my ability to navigate in the world, right? My capacity for resilience, right? And so as a parent, I do have to find sometimes what's that balance with my children, where it's like you don't want them to get hurt in any way, but sometimes that pain is what they learn from, right? And am I depriving them from being their fullest expression of if I intercede on every pain? You know what I mean? Now it's so philosophically, I'm sure that's different for different people, but I wonder too if sometimes as parents our instincts, not that they're wrong, but sometimes we may be denying our children an opportunity for.
And there's a heavy balance in that. Being in the pediatric setting, there is a great divide between, families and households that have, good support systems and those that don't. And so some of those lessons of resiliency and the lessons that make you the rose that grew in concrete, that doesn't always exist in every household. And so, I have great deep concerns for how those children learn to live with their sickle cell, and the impact that it has on them as young adults and moving towards adulthood, because you do see the difference between that good support system. You mentioned survivor's remorse, and I can't really call it survivor's remorse, but when my son goes into the hospital on the adult side, I did this experiment the first couple of times. I told him on the way there, he's in pain and everything. I'm like, don't tell him my name. Just don't tell him who I am, because I know that once they find out who I am, everything changes. And so there's this sense that, yes, I want the best care for my son, but I want the best care for everyone. And I can't tell how you really act if you treat me with privilege, because you know that I'm going to raise holy hell, and I know the people that I'm going to raise hell with. That is not the average patient, nor is that the average patient's experience. So there is that almost guilt, but how do you take that and translate that into policy change, into accountability, into improved outcomes across the board, not just for one or two or few.